Thank you, Doctor. Next, Mr. Johns, please, for 2.5 minutes.
Well, thank you both for your incredible insight. Dr. Ghosh, a couple of questions. Do you believe that there is an urgent need for national standards on substance use treatment programs? And maybe also, can you please share any thoughts or concerns you might have in the role of for-profit treatment facilities in responding to the toxic drug crisis? For example, are there consistent standards of care between facilities?
Thank you, Mr. Johns. Can you guys hear me clearly? People were breaking up there, and so I'm wondering if I'm breaking up too. We're good? Okay. So one of the concerns that I have is that there is no standardization around treatment programs across our country, let alone our province or our own jurisdictions. Some of them are medically supported and medically assisted. So this includes sites that provide buprenorphine and methadone, uh, which is evidence-based medicine. And there's others that do not provide this and do have sometimes do forced detox, for example, with opiate agonist treatments, with opiate use disorder and not providing opiate agonist treatments, which can lead to loss of tolerance and risk of relapse once they get discharged from these facilities. So I think there is a need to standardize this across the country. We need to make sure it's evidence-based and evidence-focused. It needs to have a combination of medically assisted treatments, which includes medications such as buprenorphine, methadone, but also for alcohol and naltrexone, for instance, acamprosate, but also an evidence-based system around mental health supports as well as cognitive behavioral therapy, for example, too. So these are other added layers that we need to have to support this, and it just doesn't end there. There needs to be also we need to also address their social determinants of health, which is what Dr. Patel had alluded to. But again, there is no standards around this. There is a lack of competency at times with some of these facilities, and they vary. Some of them are excellent, some of them are not so great, and some of them are private for profit, and some of them are public. And I've seen great private profit ones and poor private profit ones, and vice versa for the public system.
We're hearing about for-profit mental health in the United States, and that it's skyrocketing. Can you talk about the dangers that we could be heading when we go to for-profit care?
So this is something that I struggle with because in terms of the for-profit substance use care, provided that they're evidence-based and evidence-focused, it does provide an easy route for individuals to access, provided they have the means to access those services. So I don't necessarily think it's a bad thing, but from an equity perspective, it does not provide equity to the greater population. One of the things that Alberta has done, if I may, is that they have increased capacity for treatment supports. I think they're moving towards standardizing it, and I haven't seen that as of yet. But many of them do provide medication-assisted treatments. And last but not least, they are providing a bit more rigor around their programming. Uh, and so that is something that they are doing, but it's not necessarily ubiquitous throughout, and it needs to be better mandated, better standardized,
Thank you, Dr.
in my opinion.
Thank you.